So this brings us to motor disorders. By definition, motor disorders are malfunctions in the nervous system that create involuntary or uncontrollable body movements. And these disorders can also cause a lack of intended movement. Their symptoms are tremors, jerks, twitches, spasms, contractions, or gait problems, which are abnormalities in walking. And according to the DSM-5, these disorders are placed in three separate categories. Those being developmental coordination disorder, stereotypic movement disorder, and tic disorders. Tic disorders consist of Tourette's disorder, persistent chronic motor or vocal tic disorder, and provisional tic disorder, which I'll touch on a little more in depth soon. So the first disorder that we'll look at is developmental coordination disorder, also known as dyspraxia. And this disorder is a result of inaccurate transmission of brain messages to the body. So a diagnosis of this disorder can be made by a clinical assessment, physical examination, a school or workplace report, and individual assessment using standardized tests. So in order for an individual to be diagnosed with this, their motor skill coordination must be substantially below what's expected for their age, and these deficiencies must interfere with their activities of daily living, such as clumsiness, poor balance, posture, having poor hand-eye coordination, poor handwriting, perception issues, speech difficulties, among other things. And these deficits or behaviors must not be better explained by an intellectual disability or visual impairment or a neurological condition affecting movement, such as cerebral palsy, muscular dystrophy, or a degenerative disorder. So next we'll talk about stereotypic movement disorder, which might occur with fetal alcohol exposure or as a result of amphetamine intoxication. And one way of telling this disorder is observing that the individual has repetitive, seemingly driven or impulsive and apparently purposeless motor behavior. These behaviors must also interfere with social, academic, or other activities. It might look like hand waving, or hand shaking, body rocking, head banging, self-biting, or hitting oneself. And this disorder cannot be attributed to the physiological effects of a substance or a neurological condition, nor can it be better explained by another neurodevelopmental or mental disorder, such as trichotillomania or obsessive compulsive disorder. So the last set of disorders we'll look at within motor disorders are tic disorders. And what really specifies the difference in diagnosis between these disorders is the duration, cause, and clinical presentation of the individual. So the three main tic disorders are Tourette's, persistent motor or vocal tic disorder, and provisional tic disorder. Other specified and unspecified tic disorders are also listed in the DSM-5 for individuals with symptoms that are characteristic of a tic disorder but do not meet the full criteria. So just to give a little bit of context, if you don't already know what a tic is, it's a sudden, rapid, recurrent, non-rhythmic motor movement or vocalization. This might look like blinking or shrugging your shoulders, humming, clearing your throat, or yelling out a word or phrase. Although these tics might not always happen at the same time. So if you look at the criteria A for each, the criteria A for each of these disorders, this specific criteria is most telling of what differentiates between the diagnosis. So if you look at Tourette's disorder, you must have 2 or more motor tics and at least 1 vocal tic. But with persistent chronic motor or vocal tic disorder, you must have 1 or more motor tics or vocal tics, but not both. And then lastly, in provisional tic disorder, you must have at least a single motor and or vocal tic. So developmental coordination disorder is has the highest prevalence in the United States. Um, However, all of the disorders occur across racial, ethnic, and cultural backgrounds. Um, Males are more affected than females in all of the disorders, and developmental coordination disorder occurs across cultures, races, and socioeconomic conditions. Um, However, by definition, quote unquote, activities of daily living implies cultural differences which require consideration of the context in which the individual child is living, as well as whether he or she has had appropriate opportunities to learn and practice such activities. So, attitudes toward unusual behaviors may result in a delayed diagnosis. At least 1 in 5 children experience some form of tic disorder, most frequently between the ages of 7 and 12. And in addition to cultural attitudes towards unusual behaviors and motor disorders, help seeking and patterns in help seeking and choices of treatment can also influence the prevalence and diagnosis of these disorders.